Hey guys, Ashley with Amare. So, let's talk about something. BBLs, Brazilian butt lift. We're going to talk about caring for them and the things that happen with them. So, if you don't know what a BBL is, if you're interested in getting one, if you need information on like, okay, what the hell is she talking about, go over to our other video that's like forever old that talks about BBLs. So, that's the first thing. All right, so BBL, you got one, right? Let's paint a picture real quick. So, your butt. Let's picture your fat and your butt as like Play-Doh, right? All around your body, it's Play-Doh. So your stomach, they're taking out the fat from here, Play-Doh, fat from here, and they're taking it and putting it here. So your whole body is Play-Doh, right? So if we scrape off all of this Play-Doh, we then need to smooth it out and make sure it dries properly so that when it dries without any bumps, no lumps, no cracks, nothing like that. That's what your garment, your foams, and your MLD is for, your massages. That's to make sure it heals smooth, kind of like spackle, right? So let's say you take a wad of spackle and you go to fill up a hole. If you don't take a wet cloth and wipe off the excess spackle, you're then going to have to go back and sand it down 1,000,000 times to make sure that it's flat. Otherwise, it heals all lumpy and weird and it's permanent. So stomach and lipo area, same thing. Now, BBL is a little different. Your BBL, you have this Play-Doh that you're starting with, and we're adding more Play-Doh on top of it. So the Play-Doh underneath is already your skin. It's already dried. It's already your tissue, right? The BBL part, the fat cells that we're adding on top of that, are now like wet Play-Doh that we need to heal and stick properly. Very, very common thing that I hear, which people also don't understand. Yes, you can mess up your BBL, but by not taking care of it, that doesn't mean that your butt's just gonna go back to the way it was beforehand. You just put a new chunk of Play-Doh on top of that. Yes, if you sit on it, yes, if you do all that, the fat cells die and your body can reabsorb them. But depending on how much swelling you have and fibrosis around those fat cells, that stuff is going to heal and stick. And if you're laying on it, if you're sitting on it, if you're in a bad garment that's cutting into it, squishing it, or even a garment that doesn't have any support in it. So a lot of BBL garments just have like that one, they've got, first of all, let's go to the extreme. I've seen the ones where it's literally just a hole. Your butt is sticking out through a hole in the garment. No, because that hole where the seam is putting pressure and squeezing that fat transfer, number one. And it's squeezing it and putting pressure and pushing it away from your body, which is not what we want. That's how swelling and fibrosis and messed up BBLs happen, number one. Number two, a garment that has the cutout, but it's covered by like a sheer material, just one thing of material, is not gonna hold you, especially if it's a spandexy material. All the pressure in your BBL and all the swelling is just going to swell within that material and stretch the material. The material is not going to hold your BBL. So our garments that I have designed have a capsule on the inside, which work, look at our before and afters, have a capsule of Power Net on the inside of the garment specifically designed to hold that Play-Doh in place so it doesn't move, so it doesn't expand, so that it doesn't push outwards at all. That capsule is holding your fat transfer in place so that it's healing the way it needs to. So that's the garments from the whole thing. So if you're not getting a post-op certified fitted BBL garment for you, and again, if we need to figure that out, set up a virtual with me or come into our office if you're in New Jersey. If you're not in New Jersey, set up a virtual, we'll figure out your garment. But if you don't have a proper BBL garment, it's gonna heal weird. Or your fat transfer is gonna, disappear. Now let's talk about that. So fat transfer disappearing, like I said, the fat cells will die and be reabsorbed, but the swelling, the trauma, the fibrosis, all of that can become very permanent. So when you guys think, I don't really care about my BBL, I'm gonna sit on it and it's gonna be fine. Well, honey, you're not gonna go back to the way you looked because you now have excess Play-Doh on there. And if you are squishing it, if you are sitting on part of it, if you have a garment that's indenting it in any way, you're going to see that in your results, and that's going to become permanent. It's not as simple as, I'm just not going to use my BBL pillow. I'm going to sleep on my butt. I'm going to, my doctor said I can do whatever I want. Well, yeah, but that doesn't mean it's just going to disappear magically and you're going to go back to the way you were before. That means that you're going to have permanent results based on how you take care of it. This is a permanent thing. Yes, depending on how much you've had, there are a lot of people where they don't take care of it and their butt just goes flat. Or they don't take care of it and their butt gets indented and flat. That pancake is now bigger and flat, where you have like a cleft at the bottom, or you've got like a dip at the top based on how you were taking care of it. So again, guys, the point of me saying all this is just because you neglect your BBL doesn't mean it's going to reverse and erase anything that's going on. You can get really like botched or have really bad results from not taking care of it. Meanwhile, you're thinking, oh, it'll just disappear and go back to normal. It's fine. That's not how that works. It doesn't just disappear and go back to normal. It becomes a permanent result of whatever it is. If you have that Play-Doh on there and you indent it somehow, yeah, it may look fine and it may look flat, but the flattening isn't because it went back to the way it was before. That's not how that happened. We added stuff in there, and then you, by whatever you were doing, shaped it, indented it, whatever happened to make it look like that now. It doesn't just magically disappear. Now, if you only had a very little bit, like under a liter, or maybe even 2, or like 800 cc's or whatever it is of fat transfer, and it's very minor, and there's not a lot of swelling, and there's not a lot of any of that going on, and you sleep on it, or you indent it, or whatever, you have a bad garment, whatever, yeah, it could just disappear and go back to normal, and you'll never have, any problems. But this goes off of my video that I released last week about surgery having permanent side effects that are not just surgery. This can really mess up your shape in places that you didn't have the fat transfer put in. Some people will just have the hip dips done, or just have the top of their butt done, or just have the bottom piece done, and that's fine. But all the swelling around that can travel into the part of your glutes and into the part of your butt that you didn't have surgery on and cause permanent cellulite. Cellulite is just pockets of fluid that get stuck in between. Now again, you may not have had it before, and now you have it because the garment pushed fluid into that area and caused the cellulite, because the fat transfer moved and dripped down. Because again, guys, from week 1 to 2, it's just liquid. You guys see the videos on Instagram. They take your fat out, they put it in a tumbler, they spin it, they clean it, and then they re-inject it into you. The point of the garment is to hold that fluid so that it sticks where it needs to, and then as your body heals and with lymph drainage throughout the rest of your body, that area comes down, heals, hardens, becomes that Play-Doh that becomes perfectly sculpted and hard and well, in this case, soft, because it should feel like breast tissue or the tissue on your thighs. It should be soft through and through. Now again, if you don't have a proper garment, if you're sleeping on it, if you're laying on it, if you're sitting on it, if you're, because it was so minor you don't feel it, you can create little lumps of fibrosis in there in areas that, again, you necessarily didn't have the fat transfer because it's all in the same area. So they're putting it in there and it's floating around from week 1 to 2. It's still in that like liquid floaty state. Weeks 3 to 5 is when it really starts to stick, get its own blood vessels, become its own thing. And usually they say by 6 weeks you're done. If you've been getting MLD, if you've been taking care of it, your tissue back there should feel soft and supple like normal tissue through and through. You should be able to feel your actual bones in there. So again, this stuff is permanent. It's not just like, oh, whatever, I'm not going to take care of it. Okay, so now that we've talked about that, how do we take care of it? Like I said, proper garment. How do you know what the proper garment is? Set up a virtual, because for every body type it's different, for every fat transfer it's different, for every BBL it's different. In our office, we have my custom garments that are for BBLs that I fit for perfectly, and they come out great. Again, check our before and after pictures on our feed. But again, that's something we have to actually have a consult about. So virtual or come in. The BBL pillow. I'm going to say this once. Do not think all BBL pillows are the same. Your BBL pillow should be a brick, styrofoam, through and through. No cushion top, no velvet, no soft squishiness. If you are not sitting on it perfectly straight, like if your body isn't held up perfectly straight, it's not working for you. If you feel pain from your BBL pillow, if it's uncomfortable, if it's pushing into your fat transfer, if your thighs are going numb, if it's anything except comfortable, you're doing it wrong and it's not the right pillow. Again, they are not all created the same. That's all I'm going to say. We sell the ones that work in our office. Getting them from Amazon is like getting a garment, Russian roulette. You have no idea what you're getting. You don't know the kind of material and all that stuff. Again, set up a virtual or come in and we can help you with that. But again, they are not all the same. And if you're having problems with your BBL pillow, you need to fix that, because that's something you should be sitting on 24/7 for 6 weeks until you're healed, along with your garment. And you shouldn't be sleeping on your back. You should be sleeping on your stomach. Now, this avocado thing, this BBL mattress thing, guys, gravity is where things are going to fall. If you are laying on your butt, you are putting pressure on it. If you're squeezing it into a hole, if you're taking a gravity chair, cutting a hole in it, and then squishing your butt into it, and it's putting pressure on your hips, your lower back, all of the area down there, everything from your hips, you're literally creating your center of gravity down that way, and squishing everything. So yeah, it's going to put pressure on that. It's going to affect your fat transfer. It's going to affect your BBL. Stop buying these gimmicky things. Sleep on your stomach. Sleep, supported with pillows. Sleep in a recliner with your BBL pillow underneath you and pillows on your back so that you're lifted, but your butt is not being squished at all. There's no pressure on it. And if you need help with this, set up a virtual, come in and see me, and we'll figure out exactly how to sleep. It's one of the number one things that we spend the most time in your post-op or pre-op sessions, especially pre-op sessions, is teaching you guys how to sleep, how to sit, how to drive, and how to function, because you should be up and driving and moving that week. Unless you had like a tummy tuck or other crazy surgeries. But if you just had BBL lipo, you should be up and mobile. You should be going. Life should be easy. You shouldn't be, on your knees 24/7. Guys, standing that long and being on your knees for that long without sitting, without laying down or anything like that puts pressure on your blood vessels. Now, yes, you have the compression socks, but it's also going to make your legs swell because, again, gravity, everything down there is where all the swelling is going to go. And also, your muscles are fatigued. You're exhausted. You're in pain. You just had surgery. So there has to be better ways for you to do this where you're taking care of your body and letting it rest. Otherwise, you're not going to heal properly. So BBL pillow, garment, stop with the whole avocado, gravity chair, BBL mattress, crazy money wasting stuff. Set up a virtual if you need to. There is a correct way to sit on your BBL pillow, by the way. So with our garments specifically, I teach you guys how to do that. It's really hard for me to teach you that over these videos because it's different for every person. But basically, and you're swollen, you're not going to feel this, but the BBL pillow goes underneath your thighs. So the bottom of your glutes, or like where your thigh starts and then your glutes start, like where your thigh ends and your glute starts, that part of your body where you're folding in half, like, let's see if I can show you, like where the bottom of my shorts is, like this part is what should be on the back of the BBL pillow. So it should be under your thighs and you're scooted forward and you're sitting on it and you're relaxed back into it and your butt is not touching anything. It's completely lifted off the surface that you're sitting on. The BBL pillow is holding you up. Same thing when you're driving, the same thing when you're sitting. So I hope that helps a little bit. But again, all of this I can teach you specifically, like to the point, in a virtual consult or in our post-op and pre-op sessions. So make sure you guys schedule that. I hope this video was a little bit helpful. BBL tips and tricks and all of that. But again, guys, this stuff is permanent. Even if you don't take care of it, it's still going to permanently affect your body, whether you really see it or not. So I hope that was helpful. I will see you guys soon. Have a great rest of your day. Thank you for watching. Bye.